Hello, everyone. My name is Braden, and today I am going to be presenting on behalf of my group Mohammed, Osa, myself, Rosemary, Etty, and Hungming. We're going to spend the next 10 minutes ish discussing a topic that is often stigmatized but is one of the most prevalent health challenges in our country: problematic alcohol use and alcohol use disorder, otherwise known as AUD. As future nurses, we will encounter this in every clinical setting we are in, from maternity wards to geriatric care. So it is a very important understanding that.
Hello, my name is Hongming. Uh, so for this slide, I want to talk about our presentation overview. Our presentation is structured to give you a 360-degree view of issue. We will start with hard numbers, the statistic in Canada today. Then we will move into clinical side, like how do we actually diagnose AOD, the alcohol use disorder. Then we will look through a sociological lens at the determinants of health that drive these numbers. Finally, we will finish with the most important part for us. It's the nursing intervention and the community resources that could help our patients transition from crisis to recovery. Uh,
So, just before we begin deep diving into this, I just wanted to talk about the pathology, physiology of alcohol use. So, the classification of it is a central nervous system depressant. Neurotransmitter interaction, it enhances GABA, the primary inhibitory transmitter, which it just slows your brain activity. It inhibits glutamate, which is the primary excitatory neurotransmitter, so it reduces your brain stimulation. Short-term effects resulting slowed state leads to slurred speech and impaired motor coordination. Tolerance development: over time, the brain attempts to compensate for the constant presence of depressant, leading to the need for higher quantities to achieve the same effect. I'll talk about that a little bit later as well. Um, and physical and long term health consequences. So, liver health, high risk for liver cirrhosis, permanent scarring, and hepatitis. Cardiovascular system linked to hypertension, cardiopathy, and increased risk of a stroke. Carcinogenic risks: chronic use increases the risk of various cancers, for example, liver, throat, breast, and esophageal. And nursing priority: nurses frequently treat those secondary physical complications while simultaneously managing the underlying action.
so for this slide, I want to talk about the key statistic of AOD in Canada. So look at this current landscape. According to the 2023 Canadian Substance Use Survey, alcohol remains the most widely used psychoactive substance in Canada. It isn't even close when you compare to other substances. About 79% of Canadians aged 15 and older reported drinking alcohol in the past year. So now, drinking alcohol doesn't automatically mean there is a disorder. However, the survey found that 46% of Canadians are drinking three or more drinks per week. Well, that might sound low. When we look at the lifetime prevalence, nearly 18% of Canadians, that's one in five people you meet, will meet the clinical criteria for AOD at some point in their lives. As a nurse, this means 20% of our patient population is potentially struggling with this, whether they are admitted for it or not.
So, going into the etymology and demographics, who is at most at risk, you might ask? The data shows a higher prevalence in males, but the age demographic is what really stands out. The high risk window is between ages 18 to 34. This is the period where binge drinking is most common. So, why is this age group so vulnerable? It's a combination of social transition, brain development, and often the first time individuals are living away from home. Most people are diagnosed between the ages of 18 to 29. If we catch these patterns early, we can prevent the long term chronic physical pain damage that usually doesn't show up until a patient's in their 40s to 50s.
So for this slide, I want to talk about the signs and symptoms of AOD. As nurses, our assessments start the moment we see the patient. We break symptoms into three categories: behavioral, physical, and psychological. Behaviorally, we look for loss of control. Is the patient drinking more than they intended? Are they spending a lot of time obtaining or recovering from alcohol, which is affecting daily responsibilities? Physically, slurred speech is usually a big red flag. We also look for tolerance, needing more or get the same effect, and withdrawal symptoms like tremors or sweating. Psychologically, we're looking for craving, that intense internal urge to drink that overrides other cells. Social withdrawal, anxiety, and depression is also a key indicator.
The social determinants of health. We have to ask, why is the alcohol use happening? It's rarely just about the substance. We see higher rates of indigenous populations, which is a direct result of historical trauma and systemic inequities. Think about the other determinants like income and geography. If you are in a rural area with no local detox center, your chances of recovery drop drastically. If you're experiencing homelessness or unemployment, alcohol may be a coping mechanism for survival. As nurses, we must practice cultural humility and recognize that our patient's environment is often the biggest obstacle to their sobriety. So, diagnosis, the DSM 5, how do we make it official? We use the DSM 5. To be diagnosed with AUD, a patient must show at least two of the 11 criteria within a 12-month period. 2 to 3 symptoms is considered mild, 4 to 5 is considered moderate, and 6 or more is considered severe. It is important to remember that AUD is a spectrum. A patient just doesn't have to be hitting the rock bottom to have a AUD. A student who misses classes and can't stop after 2 drinks might already meet the criteria for a mild disorder. Early nursing interventions at the mild stage could save someone's life. That is very important. Now, moving on to treatments. So, there's pharmacological and non pharmacological. Pharmacologically, we use naltrexone to reduce cravings, ecam for withdrawals, and disulfiram is to create a physical deterrent. So if somebody takes it well on that, they become physically ill. And non-pharmacologically, cognitive behavior therapy, CBT, and motivational interviewing are gold standards. We also rely heavily on support groups like Alcoholics Anonymous. So for the nursing assessments, our assessment must be thorough. We check vital signs and look for neurological signs of withdrawal. We also assess the patients for readiness to change. To remain objective, we use tools like CAGE and audit screenings. These help us quantify the drinking patterns and determine the level of risk a patient is facing and how much help they will need. Nursing interventions. Our directed interventions include managing withdrawal often using benzodiazepines and providing patient education. It isn't just about the acute phase. We must monitor for potential relapse and connect the patient to a community support. We act as the bridge between the hospital and a sustainable recovery environment. So community resources. Recovery happens in the community. We recommend addiction treatment centers like AA, Smart Recovery, and Indigenous wellness programs. It is also vital to support the family through services, as AUD doesn't just affect the individual, it also affects the entire household. I would like to share a story. I have an alcoholic in my family, and they have been sober for about 50 years now. They just received their 50-year chip not too long ago. It is very important to me that he seeked the recovery all those years ago, because without him, I don't think I'd be the person I am today. And now he is still going to AA. He makes it very important. He gets there every Saturday, and he makes sure that other people understand that there is a way through it, that alcohol is not the right thing to turn to. And he makes sure to give motivational speeches there about his life and how he did it. And he now is sponsoring multiple people trying to get their life turned around. So I think it is very important for community resources to be used that way. So, importance to nursing practice. Why is this our job? Nurses are often the very first people to identify an AUD in patients. We provide the holistic care and address physical, mental, and social health simultaneously. Early intervention by a nurse can drastically improve a patient's long-term outcome. So that's why it's important to us in this job. In conclusion, AUD is a major public health issue in Canada. It's affecting about 18% of the population. It requires comprehensive, non-judgmental care. As nurses, we play a key role in the recovery journey, from the first assessment to long-term community support. Thank you all for your time today. And if you have any questions or concerns, please reach out to me. Thank you. Have a great day.